Hey there, and welcome to PTCB Prep Guide. So if you're gearing up for that pharmacy technician exam, or, just want to get a solid handle on blood and anemia, you are in exactly the right place. We're going to jump right in.
All right, so here's the game plan. We're going to break down everything you need to know about red blood cells and all the big hitter types of anemia. We're talking the must-know medications, the high-yield facts, all in a super simple, visual way. Seriously, think of this as your personal digital flashcard session. We're going to get you totally prepped for that exam.
Okay, first things first. What even are red blood cells, or RBCs, as you'll see them called? The easiest way to think about them is like they're the body's little oxygen couriers. That's their main gig, their one critical job. Grab oxygen from the lungs and deliver it everywhere else. Super important.
So how do they do it? How do they actually hold on to the oxygen? Well, that's where this superstar protein called hemoglobin comes in. If the red blood cell is the delivery truck, hemoglobin is the driver inside who physically grabs the oxygen and holds on for the ride. It's that simple. No hemoglobin, no oxygen delivery. It's absolutely crucial.
So let's trace the journey, right? It's really just 3 simple steps. 1, you take a breath, and oxygen fills up your lungs. 2, the red blood cells passing by grab that oxygen with their hemoglobin. And 3, they zip around your whole body, dropping off the oxygen to every single tissue. Lungs, to RBCs, to the body. It's a pretty elegant system when it's working right.
So that's what happens when everything is running smoothly. But what happens when it's not? What happens when that delivery system breaks down? Well, that's where we get into our main topic today, anemia. Anemia is basically what we call it when that oxygen delivery system goes wrong.
So, what is it exactly? Anemia is pretty straightforward. It's a condition where you either have too few red blood cells or the ones you have don't have enough hemoglobin. And look, either way, the end result is the same. Your body just isn't getting enough oxygen to do its thing.
And what does that feel like? I mean, when your body is starved for oxygen. The classic signs are feeling super tired and weak all the time. That's the fatigue. You might have pale skin because you don't have as many of those red-colored cells. And, of course, shortness of breath as your body is literally trying to get more oxygen in. You're definitely going to want to lock those 3 into your brain for the test.
Okay, here's a key thing to remember. Anemia isn't just one single thing. It's actually a bunch of different types, and each one has its own cause and its own treatment. So let's do a quick run-through of the main ones you'll see on the PTCB. We're going to do this flashcard style, nice and simple.
All right, first up, sickle cell anemia. This one's a genetic disorder, meaning you inherit it. And what happens is the red blood cells get misshapen into this weird, stiff crescent shape, like a sickle. And because they're not nice and round anymore, they get stuck in tiny blood vessels, causing these awful little traffic jams that are super painful.
So for your exam, here's what you got to know. 1, it's genetic. 2, those blockages lead to something called pain crises. And 3, the 2 big medications are hydroxyurea, that helps make the cells less sickly, and folic acid, which helps the body crank out more red blood cells in general. Okay, next on our list is microcytic anemia. And hey, the clue is right there in the name. Micro, like microscope, means small. So in this type of anemia, the red blood cells are just too darn small. And what's the #1 reason this happens? 9 times out of 10, it's a lack of iron. So naturally, the treatment is, you guessed it, iron supplements. But, and this is a huge pro tip for the exam, vitamin C is like iron's best friend. It helps the body absorb it way better. That's why you'll often hear that patients should take their iron with a glass of orange juice. That's a classic test question right there. All right, now let's look at the complete opposite, macrocytic anemia. And again, the name gives it away. Macro means large. So this time, the body's making red blood cells that are way too big, and they're often kind of immature and don't work right. So why are they so big? Well, the most common culprits are a deficiency in either vitamin B12 or folate. That's it. So the treatment is super logical. You just give the body what it's missing. That means either vitamin B12, which is often an injection, or folic acid supplements. Okay, stop and look at this. This is so important for the exam because they love to try and trick you on this. Let's just burn this into our brains. Microcytic means small cells caused by low iron treated with iron. Macrocytic means large cells caused by low B12 or folate, treated with B12 or folate. Got it? Don't mix them up. All right, let's switch gears a bit. Next is anemia of chronic disease. Now this one's different. It's not about a lack of iron or vitamins.
Instead, it's a type of anemia that happens because of some other long-term illness that's going on, like chronic kidney disease or even cancer. Basically, that long-term illness messes with the body's whole red blood cell making factory. Now, of course, you want to treat the main disease, but the one specific medication you have to know for the PTCB is erythropoietin, or EPO. Think of EPO as a little messenger that goes to the bone marrow and says, "Hey, wake up, we need more red blood cells."
Okay, now for a totally different kind of problem. Hemolytic anemia. Let's break down that word. Hemo is blood, and lytic means to break or destroy. So with this one, the problem isn't making the cells, it's that the body is destroying them too fast. They're being popped like little balloons way before their time. It's a destruction problem.
So what's causing all this destruction? Well, it could be the body's own immune system going rogue, or maybe certain medications or infections. The goal is just to make it stop. And for the exam, when you hear autoimmune hemolytic anemia, your brain should immediately think steroids. Steroids calm down that overactive immune system.
And last but definitely not least, we have aplastic anemia. Now, this one is rare, but it is super serious. This is when the bone marrow, the body's blood cell factory, just stops working. It shuts down. And it doesn't just stop making red blood cells, it stops making white blood cells and platelets too. Everything.
Yeah, because it's so serious, the treatments have to be pretty intense. We're talking about immunosuppressants to calm things down if that's the cause. But in the most severe cases, the only real fix is a full-on bone marrow transplant.
Whoa, okay, I know that was a ton of information, but this right here, this slide pulls it all together. This is your ultimate medication cheat sheet. If microcytic is the problem, iron is the answer. Macrocytic? B12 or folic acid. Sickle cell? Hydroxyurea. Chronic disease? EPO. Hemolytic? Steroids. Seriously, pause the screen, take a picture of this. This is pure gold for your exam.
All right, you ready for a final lightning round? Let's lock this in. Red blood cells, they carry oxygen. Iron deficiency? Microcytic. B12 or folate deficiency? Macrocytic. Sickle cell? Hydroxyurea. Chronic disease? EPO. Hemolytic? Steroids. And aplastic anemia? That's bone marrow failure. You got this.
And there you have it. That's your quick and dirty guide to red blood cells and anemia, all geared for PTCB success. We're putting out simple, bite-sized lessons just like this every single week because studying shouldn't feel like a chore. So do yourself a favor, subscribe to PTCB Prep Guide. Let's help you study smarter, feel more confident, and absolutely ace that exam.